I'm really pleased to introduce you to Dr. Akila today, who's very kindly decided to join us to talk to us a little bit about her work. So Akila is an NHS consultant physician in stroke, geriatrics and general medicine, which sounds incredibly impressive, but she isn't only a consultant. She also has a PhD in communicating with shared decision making around severe stroke, which she completed in 2020. And that's obviously hugely relevant to the work that we do at Pogo Digital Healthcare, because we're working within stroke communication. So Akila's here today to tell us a bit about her role as a doctor, but also it's been fantastic for our team here at Pogo because we've been able to work very closely with Akila to make sure that the work that we're doing around our product tailored talks really is tailored effectively to people who are suffering post-stroke. So Akila's played a really important role in supporting us with that, feeding back, trialing products, seeing what works with patients and what doesn't. So it's going to be really, really exciting to hear from her today. Right, so Akila, I think I'll just double check we haven't got anyone else signed on. For those people who have signed into the webinar a little bit late, I just wanted to repeat that this webinar is recorded. So if you don't want your face to be shown within the recording, if you can just cross that now, then it won't be shown within the recording. Right, I'm just admitting 3 more people and then we'll get started. Right, okay, so my first question to Akila is, what led you to become a doctor and to specialise in the care of the elderly and stroke?
Thank you, Zoe, for the kind introduction and for inviting me to this webinar today. It's really nice to see so many people who have joined in, and I'm very excited to speak about my work with Pogo Digital Healthcare today. So really, in a nutshell, it is my personal experience with doctors, in particular geriatricians, or as we say, care of the elderly doctors, looking after my grandmother when she was ill, as well as support and encouragement from my parents and grandparents that led me to become a doctor, and specifically to specialize in care of the elderly and stroke. And really, from a young age, I've been interested in science, and I've always wanted to know the reason why. I think both my mum and dad have joined this webinar today, and they'll probably confirm that information. I did some work experience in a local hospital, which cemented my conviction to pursue medicine as a career. It was really a no-brainer for me at this point, as I saw how much a doctor made a difference in someone's life. And all through medical school, I really found myself being drawn towards care of the elderly, and really where I saw how doctors were so skilled through sensitive communication and effective communication, how they involved patients and families in decision making. And later on in my training, I developed an interest in stroke medicine. And that was really because of 2 things. Firstly, stroke is a rapidly expanding specialty, which is very research driven. And the idea of working in an area that is expanding and focuses on evidence-based care really appealed to me. And secondly, stroke is also a specialty where there's a good mix of acute training opportunities, that is early on, like early stages of a person being admitted into hospital, as well as ongoing patient care in rehabilitation and in outpatient clinics, which really means that a doctor can be involved in the whole patient journey, which really appealed to me. And now, as you've correctly said, I've just started in the last month my post as a consultant in stroke and care of the elderly. And so far, I'm really enjoying working in these specialities where I've had multiple learning opportunities and also being part of an invaluable dynamic multidisciplinary team.
That's brilliant. And it's so interesting. I mean, it's really interesting to sort of hear about your journey. So what led you, you've talked about working as a doctor, but what led you to work within research, which is obviously quite separate to the clinical work that you would typically do?
Yeah, absolutely. In a way, it's separate, but also in a way, it's very closely linked because researchers and doctors work very closely with each other in order to deliver optimal patient care. So It's just based on personal experience. So when I was a senior doctor working on the stroke wards and covering stroke clinics as well, I was often asked by patients regarding their prognosis after stroke. So questions such as, will I be able to walk again, doctor? Or when will I be able to talk? Were questions that I got quite regularly. And I actually found it quite frustrating because I was not able to accurately predict the trajectory of their recovery and also to communicate this uncertainty. I spoke to a few of my colleagues and I found that actually I was not the only one finding this. I then explored different options, and I'm very grateful that Professor Martin Dennis and Dr. Will Whiteley then took me under their wing to support my research interests. This first led to a review of literature, so what research is out there in the area that I was interested in. And then that then led to me successfully securing competitive funding from the Chief Scientist Office within the Scottish Government in order to do my PhD, which focused on how we better communicate with and involve patients who've had a stroke in making decisions about their treatment. And a direct output of my work has been tailored talks, which you've touched on, and I can expand on a little bit later.
Brilliant, thank you. To question number 3, what are the greatest challenges that clinicians in stroke face when it comes to communicating with patients and their families?
Thank you, Zoe. That's a really good question. So in my experience, challenges broadly fall into 2 categories. So patients and carer related factors and also doctor related factors. But in practice, I think we may all appreciate that it's not so black and white. So if I think about a person who's had a stroke, and I'll just talk everyone through a patient story. So recently I met an elderly woman who presented to hospital with right-sided weakness and speech problems. And she was completely independent before this episode happened. And for her, this loss of function was really overwhelming, and she was in shock and incredibly emotional, understandably. But the stroke also had an impact on her ability to understand information, i.e. her cognitive function was affected by it. Her family, who were all very close to her, were also very distressed, in shock, and they were not in a position to communicate the patient's wishes or needs. And at this emotive time, I, as the stroke doctor, am trying to communicate information that is complex, whilst I myself don't know the trajectory or the recovery of this disabling stroke for this particular person. And communicating this uncertainty at a time when the patient and the family might be looking for hope of surviving and being independent again, and really looking from me some certainty and clarity on whether this is likely to occur, and if it is, when it's likely to occur, when I myself don't really know, can be very tricky. And unfortunately, there are really no easy answers to this challenge.
Yeah, it's a really difficult one, isn't it? It's a really difficult one. So with that in mind, would you be able to talk us through the research that you've been working on recently?
Yeah, sure, Zoe, of course. My research is something that I'm very passionate about, and I probably could talk about it for ages, so just stop me if you're getting bored.
We've got time, we've got a bit of time.
So my research is really focused around building the practice of realistic medicine into clinical practice in stroke. And for those of you who might not know, Realistic Medicine was a document that the Scottish Government first published in 2014. And since then, there's been a few more updates on that, which emphasizes the need for medical professionals to ensure that patients and families are listened to and their preferences are taken into consideration when making treatment decisions. So it's really seeing the patient and their family, if they would like their family to be involved, as in the heart of everything that we do. So the way that I've been doing this is focusing on 2 main areas. So the first is on prediction of outcomes after stroke, because it's very difficult to predict prognosis and trajectory after stroke. And second is on ways to better communicate with people who've had a stroke and their families in order to involve them effectively in making treatment decisions with respect to their care. So my work has shown that information that's tailored to the individual's specific needs is required, and that this information should be delivered in different formats to suit different needs, because different people like information given to them in different ways. And it also should be delivered early on in the patient's journey, but bearing in mind that some people may not be ready to accept that information then, and therefore there needs to be some kind of platform where this information can be revisited. And this has led to the development of tailored talks in collaboration with yourself, Zoe, with Pogo Digital Healthcare. And this really is a digital communication tool. It consists of slide sets of information that healthcare professionals can pick all the relevant slides in order to tailor a talk that's relevant to that person that they are speaking to. So we're giving relevant, tailored information to people that is specific to their needs, rather than giving them booklets that might contain information that is not relevant to them. The information on tailored talks is also available in different formats and can be used as a record throughout the patient's journey, because it can either be printed, it can be sent in email, it can be given as a PDF document. And currently I'm involved in further work to refine the content of tailored talks and also implement it within our local stroke service. And I'm actually very excited by its potential to positively impact on patient care.
Which is brilliant, and is exactly what we want to be hearing. So what could be used to support, apologies, what could be used to support physicians in giving information to patients and families? And you touched on this a bit, Akila, already, but what, in your opinion, works best? What tools and strategies are most effective?
Sure, thanks, Zoe. So I think, first of all, physicians tends to sort of imply that it might just be doctors who are giving information to patients and families, but I actually work with a team of various healthcare professionals. So nurses, physiotherapists, occupational therapists, and speech and language therapists, and dietitians as well, all provide patients and families with information. So I think, again, in my opinion, there are three things that could be done to support us in giving information to patients and families. The first is to acknowledge and cultivate an environment that is supportive and open to discussing challenges in communication. Because as we discussed, it's not something that's very easy, and I suppose it doesn't come naturally to a lot of people. And the second is on formal communication training. And I feel that the best way is through simulation. And I've been involved in a lot of simulation training within the university curriculum. And I do think that it's very useful having real life scenarios, but in a controlled environment where you can practice with your colleagues and learn from each other. And thirdly, a tool or a performer that really acts as an aid memoir to help us to have a structure to our communication. Because in the best of times, sometimes we all go in with a lot of information, and sometimes we might forget something. So really having a performer would really be helpful. This is already existent in a lot of areas of medicine. It happens in palliative care, in stroke. But this is, again, where I believe a tool like Tailored Talks is really important, because it can be beneficial to physicians and healthcare professionals, not just as an educational resource, but also it can help us structure our conversations.
Yeah, which is brilliant, and something that you've been using, and hopefully something we can encourage more people to use as well.
Yeah, absolutely. And I know that some of my colleagues have been using it and are finding it very useful, as well as patients as well.
Brilliant. Right, well, those are all of my questions, but we've still got plenty of time, and obviously we've got quite a big audience here today. I'm sure lots of people who have been listening have probably got questions as well. So if anyone's got any questions for Akila, if you could put those into the chat, and then we can take it in turns and hopefully have give people a chance to ask the questions that they might have. So we'll just give people a few minutes and see if they've got any questions. And if not, I've got a few. So I'll fire away with a couple of questions afterwards in case we haven't got any. Let's see. To see if anyone's... Alternatively, you could just raise a hand. So if anyone's got any questions, if you want to raise a hand, that's also absolutely fine. Just see if we've got any hands raised. Right. Well, if we've not got any questions, I think probably, Akila, you've explained everything very, very clearly, and that's probably why. I guess one of my questions for you would be, where do you see communication in stroke in the next 5 years? Where would you like it to be? You've talked about the areas of improvement. You've talked about, how it would be great getting colleagues to work together to practice situations before they happen, tools like tailored talks so people have got information on their fingertips. But where do you see that going in the future?
So in the future, where I would like to see it going is that healthcare professionals, patients and families can all sit down together and really have a frank discussion about their diagnosis, their prognosis and their treatment, and really work together in order to achieve an outcome that the patients and families would like. I think we do that already, but there are a lot of loopholes within communication and also provision of information. And I think with the tool like Tailored Talks, which we're hoping to implement in our local stroke service going forward kind of consistently, I think that's something that would be really good, which would help us achieve that consistency with respect to communication with patients and families.
I think that sounds really exciting for the future. Great. And we'll just give it a few more minutes in case anyone else has got... brilliant. We've had a question that's come in. Here we go. That's a good question. So Kate Ballantyne has asked, how has your work changed during COVID?
So with respect to, that's a really good question. Thank you, Kate. So with respect to my clinical work, that hasn't changed very much because as a stroke physician and as a care of the elderly physician, I was still in hospital working with patients and having direct patient-to-patient contact. However, with respect to research, with ongoing research that I'm currently doing, we've had to do quite a lot of workshops online. So at the moment, I'm working on with my research team, working on refining Tailored Talks and implementing it within our local stroke service. And for this, we had a group of about 14 members who joined us, a mixture of patients, carers, as well as healthcare professionals, in order for them to provide us feedback on information and how we can get that better tailored towards patients and families. But those they had to be done over Microsoft Teams, which in itself has had its challenges, but at the same time, it's also been really inclusive, because there are people who would find it really difficult in order to travel in. So it's cut out a lot of traveling time, and also people are able to do these workshops, sign in from home or sign in from work. So actually the response has been great.
No, that's brilliant. It's good to see some positives that have come out of COVID as well as sort of challenges as well. No, that's really interesting. We've got another question that's come in from Jackie Slater. And Jackie says, could you give us some suggestions on how best to manage the conversation when the individual has aphasia or dysphasia, and how to meet the communication needs of the individual as well as family and supporters? Thank you. I imagine the answer for both might be slightly different, but you may be able to...
Thank you very much, Jackie. That's a really good question, and it is a bit of a challenge with respect to those with aphasia or dysphasia. So they've got a speech impairment that might well affect their cognition and their understanding of information. So the speech and language therapists are very good and very skilled at this, but obviously
sorry, Akila, can I just interrupt you? I've just thought what would be very helpful would be is if you could very quickly describe for the audience what those two conditions are, so that people who aren't stroke experts will understand as well. Would that be okay?
Right, of course, yeah.
Thank you.
So aphasia or dysphasia really is a speech impairment, and there are various different kinds of aphasia or dysphasia. So there's expressive aphasia or dysphasia, which really means the patient is able to understand the information, but they are not able to express it, or they're not able to communicate it. But there's also receptive aphasia, so that means they're unable to understand the information that is being given to them. So it is quite challenging in these circumstances, and as doctors we tend to work with speech and language therapists as well as occupational therapists in order to really understand what the speech impairment that person has. And speech and language therapists often have a lot of tools that we can provide in order to have such discussion with patients and their families. So for example, there's something called talking mats that tends to be used quite a lot. So it's something that speaks out, so the person doesn't need to read that information. And really the speech and language therapists are one to really pin down and hone down on this. But also with respect to tailored talks, we are now able to, in certain talks, able to have audio or video, video information for patients and families with speech impairment, and therefore that would be something that they can tune into, and that's where we're trying to make tailored talks more inclusive as well.
Brilliant, that's great, thank you, Akila. And just to add to that, one of the things that we're working on at Pega Digital Health is to also add a talkback function to talks, and that's something that we're looking to start to introduce this autumn. So that again will be something to look out for, and again we'll support with that. So thank you, that was really good. Has anyone else got any questions? Thank you so much for to both Jackie and Kate for your questions. They were really interesting ones. We'll just give it a few more minutes just to see if anyone else has got any other questions. Right, well, if that's everything, thank you so much everyone for tuning in. This has been such an interesting talk. Akila, thank you so much for your time. I'm very aware that as a doctor and through doing research, you're incredibly busy. So the fact you've been able to give up time to prepare for this and also to present has been absolutely fantastic. And thank you everyone for tuning in on your lunch break. I hope you found this an interesting and useful webinar, and hopefully we'll see you all at our next one. I will be emailing out details at the end of October. Our next webinar will be around the pilots that we've been running, looking at how we can use technology to support long COVID. So if you have interest in long COVID, please tune in. Details will be going out shortly today and also across social media. So it would be brilliant to see all of you then. But I think if that's all of our questions, I will say goodbye for now. Also, quickly before I forget, this webinar has been recorded, so we will be sharing it again across social media, and you will also be emailed a copy. So if you have any colleagues who've not managed to make it today, or if I know there are a couple of people who came in late, if you've missed the start, then you can always rewatch that at a later stage. Okay, brilliant. Well, I think if that's everything, I'll say goodbye. But thank you so much, everyone, for coming. Okay, thank you. Bye then.
Bye.